Hey friend, are you struggling with bloating right now? Let's see what we can do to fix that for you. My name is Amy and I'm an IBS health coach and nutritionist, and I specialize in FODMAPs and IBS anxiety. And what that looks like for you is I help women with GI issues create a clear and simple plan so you can just get back to living normal life again. Today we are talking about managing bloating. And if at any point you're like, I am feeling overwhelmed, or Amy, I just want you to tell me what to do, you are always welcome to come and see me face to face during our office hours in the Flip Your Leaf community. You can join us at flipyourleaf.com/community, and I'll let you know more about that afterwards if that's something that you're interested in. But today we're going to talk about a couple of different reasons that you may be experiencing bloating. So we're going to talk about like what the actual issues are, kind of how to approach each different issue to get the best results, including both diet and non-diet tools, and we're going to talk about some examples about how you can experiment with managing bloating starting right now. Okay, so just a reminder, you are not going to need to buy or download or subscribe to anything to use this information, but I do hope you brought a pen and paper. So let's start with sort of defining our terms, making sure that we are on the same page. So what is bloating and distension? Bloating is the feeling of fullness or tension or pressure that you feel inside your abdomen. It's subjective, which means that only you can tell us if you are bloated. Only you will know. Distension, on the other hand, is something visible. It's an enlargement of your abdomen. People describe it like swallowing a watermelon or swallowing a balloon. Some people describe it like they look pregnant. We often use these terms interchangeably, but it's important to know which one you're talking about, because bloating without distension can give us clues about what's happening in your body, while distension without bloating can give us information about what's happening inside of your gut. So, not so fun fact, 66 to 90 people of IBS describe bloating as one of their symptoms. So, if you have IBS, you're probably in the right place. But heads up, every single human being gets bloated, and we want that. Okay, so normal healthy bloating is a sensation of fullness after large meals, after adding a bunch of fiber, like if you sat down to a gorgeous salad, or eating foods you don't normally eat, whether that's traveling or going to a friend's house or eating at a restaurant. And it's really important that you know that some bloating is healthy. When we eat, our gut bugs ferment carbohydrates, so fibers, and those help our body create short chain fatty acids. They support our immune system. They create neurotransmitters like serotonin, which is used by our gut to help make our gut muscles contract so that we can actually poop. And they help us absorb fat soluble vitamins, which is A, D, E, and K, which can't be absorbed by our body without help. So when we eat them, they're not in the right form to pass through our lining, and our gut bugs help change the shape of them so we can actually absorb and use those. So one of the byproducts of all of this work is gas. So when you're setting your expectations for what a healthy body feels like, sort of after your symptom management program is in place, I really do want you to remember that some bloating is healthy and normal. Okay, if you're not getting bloated, we have a very different problem and it's more complicated to solve. Okay, so problematic bloating, what we don't want is pain, cramping, or getting so bloated that you like need to change your clothes, or things are like cutting into you during the day. And that's kind of what we're going to be addressing today, okay? So, why do you get chronic bloating? There are a couple of reasons that you might sort of be experiencing this on the regular. One of them is too much food, so you're constipated. Too much food can cause like a pressure or buildup in your physical intestines, so you're feeling bloated. Your poop can also physically distend your stomach, so you look full. Your stomach or small intestine might be struggling to kind of digest food, so you feel full because you are full, and you're feeling distended because your food is sitting kind of funny in your gut. So number two is too much gas. So that can be swallowing too much air, you've got too much fermentation, or gas is kind of building up behind your poop because you are constipated. Now, number three that we're going to be talking about today is too much nervous system. So your nervous system is flipping your body into flight or fight when it shouldn't, and this could be because of stress or anxiety in your brain or in your body. It could be a response to pain, like physical, like visceral hypersensitivity, or if you're having like chronic back pain, or you have another disease or disorder that causes chronic pain. This can also cause bloating through a communication in your nervous system. Your fight or flight response also slows down digestion by pulling out blood and pulling out energy from the gut into your muscles and into your brain, and into your reflexes so that you can run away or fight if you need to. So this sort of slowing down or putting to sleep of your digestive tract can cause stool to sit in the intestines and continue to pull in water, having extra time to be fermented by your gut bugs, or having too much water pulled out while that stool sits in your colon, making that stool harder to pass over time, okay? So we're going to talk about all of these areas and help you figure out kind of what applies to you. If you have any questions, you can drop them below and I will get back to you as soon as possible. Or if you're like, you know what, Amy, I just kind of want you to tell me what to do, or this is confusing for me and I'm not sure what applies to me, again, you are always welcome to come and ask me face to face during office hours in the Flip Relief community. So we are going to start with physical issues, and we're going to kind of start from the top of the system and work our way down. So our first issue is gastroparesis, also called delayed gastric emptying. So this falls under the too much food category. And gastroparesis happens when the muscles in your stomach aren't working like they should, and food has trouble actually exiting the stomach. So normally when we eat, food is going to sit in our stomachs anywhere from 20 minutes to 2 hours. And in order to make sure that our food is sort of being delivered to the small intestine in a volume that your small intestine can have, or that it can handle, I like to sort of imagine it as dripping out like little Hershey's Kisses on a conveyor belt, right? So it's coming out in little tiny drops. So some of your food is going to start coming out at the 20-minute mark, and it can it can continue this process for up to 2 hours, okay? So if you have gastroparesis, your food might sit in your stomach for several hours, and this can cause acid reflux, nausea, vomiting, feeling full really quickly when you eat, and food sitting this way can also be a complication of bariatric surgery. So if you have something like a stomach sleeve or a band or a bypass, this might also be changing your stomach's ability to have food exit the system. So when you have an issue where food can't exit the stomach normally, again, you're going to feel full or like there's pressure there because your stomach is full, right? It's really not meant to sit there for hours and hours and hours full of food, right? So this can feel like bloating, that tension or pressure in your body. Undigested food might also do a small amount of fermentation while it's hanging out there. So together, the gas and the food particles might cause physical distension. So that looking like you swallowed a watermelon, okay? So again, you have both bloating and distension possible here. So the treatment for gastroparesis is going to depend on how it developed in the first place, okay? So if you have an issue like scleroderma or multiple sclerosis or diabetes or Parkinson's disease, or if you've suffered some kind of injury to your vagus nerve, which controls stomach emptying, your goal might actually be to manage the gastroparesis since the underlying issue can't be resolved, okay? Now, if you have developed gastroparesis after a stomach infection, like a norovirus, and you're sort of having inflammation in your stomach or your intestines called gastroenteritis, you might need to focus on staying hydrated and eating a wide variety of foods kind of while your gut recovers on its own. This is a common cause of post-infectious IBS or PIIBS, and this is one of the only types of IBS known to go into remission on its own, often around 6 months to a year after your initial infection. So again, if you're sort of recovering from this infection, your goal might be less about managing the bloating and more about helping your body heal as quickly and efficiently as possible. Now, if you have hypothyroidism, which is the lack of hormones, hormone therapy might also help you regain more control over your stomach muscles. And if you're taking medications like narcotics or certain antidepressants, changing medications might be helpful to you. So having a different chemical compound might change the medication's influence over your physical stomach muscles. So I also have a few tips on changing how you actually eat, but we're going to get into those when we hit the food section, okay? So another issue that you might have, sort of 1 degree down from the stomach, is pancreatic insufficiency. So your pancreas creates 3 different types of enzymes for your digestive tract. So it's lipase, which works with the bile from your liver to break down fat. There's elastase or protease, which helps you digest proteins, and amylase, which helps you break down starches into sugars. So fun fact, you also make amylase in your saliva. So if you are having trouble digesting starches like resistant starch, sometimes chewing them until they're an applesauce consistency can make them easier to digest just because they're getting more enzymes than normal just from hanging out in your mouth, okay? So the pancreas also makes several hormones, like insulin, which helps your body kind of regulate sugar levels in your bloodstream, helps sort of your cells absorb that sugar. Gastrin, which cues your stomach to create gastric acid, which we obviously need for the process of breaking down our food. And amylin, which helps control the gastric emptying sort of cue, so actually emptying your stomach. So if you have pancreatic insufficiency, it can cause bloating kind of the same way that gastroparesis does. So if you're not making enough gastrin or amylin, which creates the gastric acid and the cue for your food to actually exit the stomach, it's not going to exit the stomach normally. Either it's not going to be broken down correctly, or it's going to have trouble exiting the stomach at all. So this can lead to a couple of problems, one of which is malabsorption issues. So if you're not absorbing your fat correctly, you're not going to be able to absorb those fat-soluble vitamins that we talked about, which can lead to vitamin deficiencies. Your body also has an emergency braking system when it notices that fat isn't being broken down correctly, and this can cause your gut to slow down. So your body has more time to digest the fat, not realizing that the reason that there's so much fat in there is because your fat enzyme is insufficient, okay? So too much undigested fat in the gut can also trigger bloating, smelly gas, and really urgent diarrhea. So when fat enters parts of the gut where it's not supposed to be, it can really wreak a lot of havoc on your digestive system. And so that's something to talk about if you're noticing that your stool floats all of the time, if you're noticing that it is kind of greasy, if it really smells. Those are things that you want to bring to your doctor or your GI's attention, and take a picture of your poop if you can. I know it's super gross, but a picture says 1,000 words. You are an unreliable narrator. You don't know what you're looking for. You don't know what the possibilities are. By taking a photo of your stool on a bad day doing what it's doing, your doctor is going to know way more from that picture than you could ever communicate to them in words. And so I always recommend, if you're having weird poops, always take a picture. Your doctor might say they don't want to look at it, but if they do, odds are it will tell them more than you ever could. Okay. So if you are not digesting protein correctly, this can reduce your amino acid uptake. So amino acids are the building blocks of our body, and we have to eat them through diet because we can't make them ourselves. So if your body isn't getting the fuel that it needs, it's going to, again, reduce energy and blood flow to the GI system to conserve energy, because digestion is considered a secondary system in the body, like compared to making your heart beat. Okay, so having your gut slow down, again, can allow osmotic foods to pull in excess water. It's going to allow more time for your gut bugs to ferment your food, and it's going to allow in the colon for more water to be pulled out of your stool, which is going to make it harder to pass. So protein is also fermentable. So normally 6 to 9% of the protein that you eat is going to make it to your colon to be fermented, which is like no big deal. That happens to everybody. But if you're eating excess protein, like you're on a keto diet, or you're using protein fortified products like bars or shakes, the extra protein in your gut can be fermented into very, very smelly gas. So if you're having excess smelly gas, you may want to ask somebody for help calculating your protein intake to make sure you're not eating more than your body can actually sort of take up and use. That's something that a nutritionist or a dietitian or I can help you with. It's pretty easy to figure out. It's a mathematical formula. So we'd be happy to help solve that for you. And that can be a really easy way to sort of solve that really smelly gas problem. So resistant starches are a prebiotic food, meaning they're like a bag lunch for your gut bugs. So whatever doesn't break down is normally fermented. So if your amylase isn't working, and again, you make some of that in your mouth. So if the amylase in your digestive system isn't working, you may have an excess amount of fermentable starches in your gut, which can lead to a lot of extra bloating and discomfort. Again, you make these in your saliva, so make sure you are chewing your starches to applesauce consistency so your body has more time to use the available amylase in your gut. Also, breaking things down manually makes them much easier for your body to process, like as a whole, so you should really be doing that all the time anyways. You can also reduce resistant starches by not eating cooled starchy foods like rice, pasta, or potatoes. So it's okay to eat them the first time you made them, But if you're having trouble with resistant starches, we don't want to eat those as leftovers, okay? So how do we treat pancreatic insufficiency? So with this type of insufficiency, you're going to get bloated and distended because your body isn't able to break down either fat or protein or starches, maybe one of them, maybe all of them. And you're going to see a change in gut transit time because the poop contents is kind of interacting with how your body understands the digestive process, okay? So the treatment for pancreatic insufficiency is called PERT, which stands for pancreatic enzyme replacement therapy. So your doctor's going to check how much of each enzyme you need to supplement, and then you're going to get a prescription level enzyme. And it's really important to note that this is a prescription level, and it has to be like closely monitored to make sure that you're getting all the nutrients that you need out of your food. So if you don't need, if you don't need these enzymes, which you shouldn't, right? If your body's working properly, you shouldn't need these enzymes. The kind of enzymes that you're seeing like for digestive health might contain some of these enzymes, but if you were actually struggling with any of those areas, like I said, you're going to need a prescription. Like no over-the-counter supplement is going to be able to help you. If you're taking a digestive enzyme and it is like just like a global digestive health enzyme and you're noticing like, yeah, like this is actually helping me, normally they also contain lactase, which is for lactose, and alpha galactosidase, which is for things like beans and nuts and seeds. So if you are finding that that's helpful for you, you might want to test those individual enzymes, because taking them on their own means that you can dose them correctly. And you're going to get more benefit from the global one. And if you don't need any of them and it's kind of a placebo effect, now you're not wasting all your money and just making more work for your body to kind of poop out these enzymes. So, okay, so that was pancreatic insufficiency. Let's talk about something that happens a lot in our community, and that is gut dysfunction or confusion. So first of all, your body uses something called intra-abdominal pressure and gravity to poop. So there are a couple of ways that this system can get mucked up. And a few ways that a couple of the oopsies can cause bloating and digestion. So first of all, your body moves your food from your mouth to your butt using synchronized waves of muscle contractions called peristalsis waves. You might have heard of this before. And these normally occur in a chronological sequence that is meant to kind of gently squeeze food from the start of your intestine kind of down to the exit. So sometimes these muscles can get confused or kind of out of sync, which makes it harder for your body to move your food efficiently through your gut. So if you've been having like chronic watery diarrhea, or you've had chronic constipation, your muscles can lose their tone. Like they've skipped a couple of gym sessions, right? Like it's not a big deal, but they're not feeling as fit and toned as they normally are. So if you're having these issues, food might end up sitting in your gut longer than it's intended, which may again allow osmotic foods to pull excess water into the gut, allowing more time for your gut bugs to chow down, giving more time for your stool sitting in your colon to have that water pulled out. And all of these can cause also a pressure of fullness a feeling of fullness or pressure in your gut, so bloating, and they can also distend your bowel, causing distension. So this type of dyssynergic bowel issue can be treated using biofeedback and or medications that help the gut muscles kind of contract. I know there's one really popular one in the States. I think it's called Motegrity, and here in Canada I think it's called Resitran, and it gives like little gentle contractions to your muscles, which can really help build up tone in a couple of weeks. So what we're really trying to do is help the gut again contract in the right order, and we want to make sure that you're building up your gut muscles to the correct intensity so that they can squeeze the way that they're meant to. So one common thing that we see in people with irritable bowel syndrome is something called pelvic floor dysfunction or dyssynergia. So what this means is when your pelvic floor contracts, or when it's supposed to release, it's going to do the opposite of its sort of onboard job. So to kind of understand this process, there are three main muscles that make up the pelvic floor, and they're called the levator ani. And they basically make a little hammock for your pelvic organs to hang out in. And depending on your anatomical starter pack, the levator ani will have either 2 or 3 holes for your urethra, vagina, and anus. Okay, so the levator ani are the muscles that you use to hold in your urine and your stool. These muscles are supposed to be in your conscious control. So example, when you get kind of the urge to use the bathroom, you're able to kind of hold it in while you're running, and then you sit down and you're like, okay, we're good to go. And everything should relax when you're in sort of the position. So with pelvic floor dyssynergia, one of the muscles somewhere in that sequence is getting mixed up and it does the literal opposite of what it's supposed to be doing. So for constipation, that means maybe the door won't open when you sit down to go. In this case, some people need to assist having a bowel movement. So you might need to insert a finger to sort of help start or initiate that bowel movement. You might need to do something called splinting, which is when you put a finger in the vaginal canal and kind of initiate having a bowel movement. But the problem is the door's not opening when it's supposed to be opening. For incontinence, it might mean that the door isn't staying closed when it's supposed to, okay? And it's really important to know that these issues might be happening because the pelvic floor is too loose, or they might be happening because the pelvic floor is too tight. So don't just start doing random stuff you find on the internet. Make sure that you are speaking to someone who can assess what the actual problem is and then give you the correct exercises or relaxation techniques or breathing whatevers to make sure that we're correcting that problem, okay? So one of the muscles in the levator ani is called the puborectalis muscle, and this is a muscle that is going to loop around your rectum. So it starts from like the front of your pelvis, loops all the way back around your rectum and comes back to the front of the pelvis like a little loop, okay? So what happens is you poop with gravity, right? So we have our rectum here. When something goes in the chute, you get the cue, and when the door opens, it comes through. Our body has sort of like an oopsie preventer, I guess, where this puborectalis actually pulls the rectum out of position. So now it's got a little kink in it. So anything that drops into that system is not dropping right down sort of to the exit where it might apply pressure and might make it easier to have an oopsie boopsie. Basically, it's pulling everything out of sort of alignment, so it makes it more difficult for your body to poop to prevent accidents. So sometimes this muscle gets mixed up, and when it's supposed to relax to let everything sort of go through with gravity, it just gets tighter and tighter and tighter. It will not let go. It thinks it's doing like the best job. It is very confused. So you can actually manually release this muscle by popping your knees above your hips. It doesn't have to be like up to your ears, whatever. As long as your knees are above your hip, that muscle will manually release. We've taken all the tension out of that muscle and it can't squeeze anymore and it's going to relax. So this is what a squatty potty is for. This is why it works miracles. It's because it's manually releasing that muscle and everything is able to drop and evacuate properly. So you don't have to buy a squatty potty. You totally can if you want to, but you can use a box, you can use a stack of towels, you can use a suitcase if you're traveling. And like I said, you only need to get your knees above your hips. It doesn't have to be anything dramatic. So if you have back pain or mobility issue, just do your best to get your knees as high as possible. And if it doesn't work, there are other things that we can do. Don't ever cause pain or tweak anything. But if it's accessible to you, that is a very easy way to release that muscle. So again, if we're not able to release that muscle, you're going to end up with a buildup of stool in your colon because everybody's trying to get through, but they're not able to make it to the exit, even if the door is relaxed and open. And again, this buildup of stool can cause distension in your abdomen. It can make you feel like you're kind of jammed up. It can have even a normal, healthy amount of gas kind of building up behind that stool that's not able to exit. And that can lead to bloating and distension. So that one tiny little muscle can cause a lot of trouble. But you can definitely sort of release that manually. It's like if you ever, I don't know if you've ever tried to like do a squat and squeeze your butt muscles, you can't. It's because we've pulled all the tension out. That's exactly the same thing that we're doing to your puborectalis muscle. And we'll talk about the releasing the doors in a second. So another issue that you can have is something called abdominophrenic dyssynergia. So again, we poop by creating pressure in our abdomen, and it's called intra-abdominal pressure. And this is created by your diaphragm pushing down into your abdomen, your abdominal muscles tightening and pulling in like a corset, and then your pelvic floor pulling up into your abdominal cavity. So we're creating this little box of pressure. And this is one of the reasons if you are like really trying to push a bowel movement, which we don't recommend, but this is one of the reasons that you kind of hold your breath and bear down when you're trying to poop or when you're trying to lift something heavy. We're trying to increase that pressure. So sometimes when your abdominal muscles get mixed up, your body can't create the correct amount of pressure to kind of squeeze that food from the top of your digestive system all the way down to the exit. So again, this is going to mean food might move slower through your digestive system, giving it more time to accumulate excess water, more time to be fermented, more time to dry out in our colon and kind of get backed up. So with abdominophrenic dyssynergia, this can also make it sort of difficult to exercise because your abdominal muscles tend to relax when you give them the signal to contract, right? So when your muscles are sort of contracted, we call them like a girdle or a corset for your organs. And so one weird side effect of abdominophrenic dyssynergia is that sometimes what looks like bloating is actually your organs just sitting funny against your relaxed abdominal muscles, right? Because they're supposed to hold everything in. When they kind of relax open, your organs kind of push, like, and they're free to do that. Like they're kind of freestyling around in there. It's not hurting them. Nothing weird is happening, but you are getting that sort of visual distension, even though there's no actual, like what we would call bloating. There's no buildup of air. There's no buildup of water. Sometimes it's just that your muscles are sitting funny. And again, so we wouldn't want to treat that with diet. We wouldn't want to treat that with medications. We would want to treat those muscles so that they're doing what they're supposed to do. Okay. So if you have dyssynergia or another pelvic floor dysfunction, just write this down if you've got your pen and paper. Adding laxatives or fiber or trying something like the low FODMAP diet might work for a couple days, maybe a couple of weeks, but they're not going to work long term and they may make the symptoms worse over time. So if you're adding in things like Miralax or like high fiber foods or lettuce or chia seeds and the consistency of your stool is changing, but the issue isn't resolving, before you add in anything else or make any other changes, again, consider being assessed by a pelvic floor dysfunction specialist. Because if your muscles are confused or like too loose or too tight, the only way to resolve that problem effectively is to retrain them. So again, diet changes, medications, supplements, all of those things might work for a second because you're kind of shocking your body with something new. You might get kind of something resembling what you want, but if the problem is the muscles, you can only fix that by fixing the muscles. Okay, so there are a couple of ways to do that. We have something called mechanical biofeedback, which is done electronically by stimulating your muscles to work in the correct order using a gentle electrical current. That sounds really scary, but it's actually similar to, like, do you remember in the 90s, we had those like little ab belts and you'd like put the gel on your stomach and then you would like tell it like what exercise to do and it would take the current through the gel and like do all these weird things to like try and give you abs. I don't know. One of my friend's parents had it. We used to play with it all the time. But it's like that. It's not like nobody's shocking you or zapping you or anything like that. Don't be scared. Just look up one of those weird ab belts and then it's going to be like that. Another thing that they might do is something called manual biofeedback. And this is when a technician is actually going to help you learn the sensation of your muscles contracting or releasing, whichever you need. And they're going to help you learn exercises to teach your muscles to do what they need to do when you're on the toilet, when you're at the gym, when you're lifting things, wherever that is sort of not functioning correctly for you. And this might be done with your brain only. One example of that would be like Kegels. If you need those, don't do them if no one's prescribed them to you. But an example of that would be doing Kegels where you're intentionally like contracting and releasing a muscle. You might also get to use an app, which is really cool, where they put like a sensor on the muscle that is confused. You get to like drive a spaceship or drive like a race car by contracting and relaxing your muscles. So even if you can't consciously tell what is contracting or relaxing, as you're going through the exercise and you're driving your car, when your car does the correct thing, your body will loop that in your sort of nervous system as this was the correct motion, and then that motion will carry forward. So we're essentially retraining how that muscle contracts. Both of these options can be provided by a GI or a pelvic floor specialist. I normally recommend using a pelvic floor specialist just because they often have more time in the session to like talk to you and learn your body. It's normally closer to like an hour. They also usually take a more integrated approach when looking at kind of like how that pelvic floor dysfunction happened in the first place so it doesn't happen again. This type of physiotherapy can also be done in a couple of weeks. So if you think you might have pelvic floor dysfunction, like if you started today, literally you could have the problem sorted probably by the end of next month. Like when I was interviewing a pelvic floor specialist, she said she normally does her initial consultation, teaches the exercises, and then like 6 weeks later does a follow-up to see if it worked or not. She's like, if it didn't work, we'll do like 1 or 2 tweaks, and then in another couple of weeks it'll be done. So if you think you have a pelvic floor issue, like really jump on it because you could resolve it in the next couple of weeks. Okay. So now let's talk about too much gas. So we're going to start with urophagia, which is essentially swallowing air. So this either needs to come, like when you swallow it, it's either going to come out through like burping, it's going to come out through gas, or it's going to have to be absorbed somewhere into your bloodstream and then it's exhaled. But like it often has to go all the way to the end and get past its gas. So some ways to reduce urophagia, swallowing air, are to reduce straw use, because when you have like your glass, all of the straw that is above wherever the liquid line is, that is full of air. So every time you use the straw, you are gulping in whatever air was in that straw, followed by the fluid. So a couple of ways that we can fix this are, first of all, making sure that you are sealing your lips all the way around the straw. So when we're sort of drawing in the fluid, we're not drawing in any extra air. Another option is that you can blow a few bubbles before sipping to force that extra air out. Another thing that you can do is you can tip your chin down when you swallow, because that is going to pull the air up to the top of your cavity. I like lost my words. You know what I'm talking about. It'll pull the air to the top of your throat and you'll swallow the fluid and not the air, for example. Another issue is if you are drinking or eating very hot things. I know you all had the pizza too early and had a couple of like, you are swallowing all that air. That is not helpful. If you are struggling with bloating, just put the pizza down for a second, let it cool, and you will significantly reduce the amount of air that you have eaten. Okay. Another thing is to avoid excess gum chewing. And I know people need to use straws. I know people need to chew gum. A-okay, like we're just doing our best here. Okay. So if you are somebody who needs to chew gum, try breathing through your nose while you're chewing, so you're not, again, inhaling and then swallowing your saliva with all that air. You can also try switching to lozenges, depending on why you are chewing gum. And again, while you're doing the lozenge, keeping your mouth closed so you're not swallowing air when you're swallowing that saliva. Another thing is don't talk with food in your mouth. And chew with your mouth closed, obviously. Your mama should have taught you that. Take smaller bites, again, so we don't need to breathe in while we're chewing, because all of that air is going to go down along with our food. And then when you're reading aloud, like if you're proofreading something or you're preparing something, you like to read books aloud, whatever, try not to whisper. Like if you need to read it aloud, commit, because when we whisper, we're often talking while we're breathing out and we're talking while we're breathing in. Okay, so another thing is to be cognizant of swallowing air while exercising. So again, trying to breathe in through your nose and out through your mouth if you can. I'm terrible at that, so just do your best. Be careful when drinking fluids during or right after exercise. Take teeny sips and don't take a big inhale right before you sip. I see that all the time at the gym. And those are usually the same people who are complaining that they're very bloated afterwards. So if you're having issues with reflux or burping, you may want to cut out carbonated beverages. You know, everybody talks about cutting out carbonated stuff, but as long as you're cool with a couple of burps, carbonated drinks don't normally cause like the actual abdominal bloating. So again, unless you have like acid reflux or you're having like chronic burping and that's not working for you, I normally tell my clients that it's fine to leave it in. And while we are here, wearing tight clothes can also trap stool and gas, so that they're not able to move through your intestines correctly, like they're not able to flow, they're kind of pinched wherever you're getting pinched. So some things to think about is like, is your bra or binder too tight? Is it squeezing your physical stomach, or does it like come down underneath over your ribs and squeeze your intestines really tight? For a bra, kind of the general rule is if it's leaving marks on your skin, it's too tight. For a binder, if you're feeling feeling uncomfortable after you're eating or you're noticing a lot of bloating, you can try adjusting the tightness like under around your rib cage. You might also be able to get some bloating management ideas from the place where you purchased it or from organizations that teach healthy binding practices, okay? So another thing to think about is pants and skirts, especially like high-waisted pants like yoga pants. These can do the exact same thing where they're going to compress the intestines, especially if they have like an actual compression band. And this can cause stool and gas to build up during the day. So again, if your waistband is leaving marks on your body, it is too tight. And this is something really important to think about when you're traveling, because if you're sitting for a really long time, you're not going to have that natural kind of motion of your body throughout the day to kind of help wiggle everything along. You'll also be sitting for a while with your waistband cutting into you in the same position without any kind of break. It's really important to think about this when you are flying, because when you're flying at altitude, the air pressure is actually changing in the cabin and in your body. So that means that any gas in your gut is going to be expanding and taking up more space. So we don't want to skip meals because that can also cause additional bloating and a whole bunch of other problems. We want you to eat normally. We just want you to wear something loose and comfortable that is going to help the gas move around in your body and help you feel much more comfortable until you land. And obviously, once you reach our normal altitude, that gas is going to go back to its normal size, okay? So something else to think about in the kind of too much gas realm is something called small intestinal bacterial overgrowth, SIBO, and intestinal methanogen overgrowth, EMO. Okay, so we used to think that the small intestine was sterile, and this is the fun part about science. Now we're learning that actually each individual section of the small intestine has its own unique microbiome. I could like nerd out for this for a whole other masterclass. If you want to hear it, let me know. I would be more than happy to do it for you. But if you have SIBO or EMO, that means some of the bugs in your small intestine have gotten out of whack. Okay, they're supposed to be there. The problem is their population is now unbalanced. Okay, so lots of people have a weird balance of gut bugs in their gut, and part of this is because we don't actually know what a healthy range of gut bugs is. So do not let people make health decisions for you based on like gut bug poop tests. Not a real thing, okay? If science doesn't know what a healthy microbiome is yet, neither does anybody selling you any kind of gut health test, okay? So do not waste your money. So we only care about SIMO and EBO if you are having like intolerable symptoms. Okay, so there are going to be hundreds of people walking around with the exact same gut bug conditions as you, and they are having zero symptoms, and so we just leave their bodies alone. Even if they took a SIBO test and we were like, whoa man, you have SIBO, weird, we wouldn't treat that because it's not interfering with that person's life. Okay, so if you're having intolerable symptoms that might look like excessive bloating, like painful skin stretching bloating, okay, especially if it starts like 90 minutes to 2 hours after eating, or if it's like getting progressively worse throughout the day where you're like changing your clothes or people are like asking when you're due, kind of like that kind of intense bloating. It also normally impacts the GI pretty obviously. So you might have like urgent watery diarrhea as soon as you eat, or kind of like out of the blue or first thing in the morning. You can get painful cramping along with your bloating. You might be getting that crazy smelly gas throughout the day, especially if you have like a high sulfur population going on in there. Or you might get constipation that gets worse and worse and worse as time goes on. So that would be something like, you know, you were eating all your fiber and like that was doing it for a minute, and then you were like doing your fiber like plus like maybe a little fiber supplement, and then you were doing your fiber and a fiber supplement and like a small laxative, and then you're doing a whole laxative, and then you're doing a laxative plus another laxative, and it's just cycling and getting worse and worse and worse, and it's like incontrollable. That can also be a sign that you have SIBO, okay? So most of your bloating symptoms in a CMO or EMO situation are going to come from fermentation of carbohydrates like FODMAPs, okay? But your gut bugs can actually ferment a lot of different foods, and the food you choose to manage is going to depend on which type of overgrowth you have, okay? So don't just cut out things willy-nilly, especially if you're just printing lists off the internet, okay? So heads up, with SIBO and EMO, you might not have a true sensitivity to the foods that you're reacting to. The issue is that the gut bugs are kind of grabbing carbohydrates way high up in the digestive tract before they've had a chance to be digested, right? So even if you digest fructose and lactose properly, because these bugs are chowing down before the food can actually make it to the proper place in your gut to be digested, like it's going to show as a sensitivity where you're actively responding to these foods, and you can tell, like, I took out dairy, I took out fructose, and suddenly those symptoms disappeared. It's really, really important to re-challenge your like any food that you take out, whether that's FODMAP, sulfur foods, anything else you've taken out. Once you have treated your SIBO, like, don't do it mid-treatment, because again, those bugs are still going to be there. They're still going to be accessing that food before it can be digested correctly. But once you are finished your treatment, we usually give it like 1 or 2 weeks for everything to kind of settle down again. And then we want to re-challenge every single thing that we took out, because you totally might have SIBO and IBS, or the SIBO was sort of the thing fermenting all that foods. And now that that has gone back to its sort of blueprint, or the way that's right for your body, you actually can digest all of these foods properly. So I have a ton of clients who come to me like post SIBO treatment, and they are terrified to test high FODMAP foods again. And that makes total sense, because they were having like horrific symptoms when they were eating these foods. So that anxiety is completely natural and normal and absolutely makes sense. But when we get them through the low FODMAP diet, like in a way that feels not anxiety provoking, in a way that feels manageable, where they're not worried about having horrific symptoms at work, they're not worried about taking days off or ruining their weekends or whatever, we often get them through the entire process and they have zero FODMAP sensitivity. So like, oh my God, lucky we tested, or they would have just stayed in the low FODMAP diet for years and years and years for absolutely no reason. Okay, so let's talk about how we treat SIBO and EMO. Okay, so treating SIBO or EMO has two parallel goals. First, we want to figure out how you got the overgrowth in the first place. Do you have like slow gut motility and the bugs kind of like built up over time? Or did you get really backed up and your stool kind of pushed too hard on that door between your colon and your small intestine and kind of let some of the colon bugs out? Did you have like a surgery that allowed your gut bugs to move around, like having a piece of your colon taken out, or the ileocecal valve, which is that door between the small intestine and the large intestine, removed, and now your gut bugs can kind of move around a little bit easier? Did you have like a parasite or a stomach infection that changed your gut motility temporarily? Another thing is if you had like a surgery, or if you had a really bad infection and you had like a big round of antibiotics that might have thrown off your gut bugs for a second and they kind of got a little unbalanced. Really, we want to find the root cause, if we can, of how that buildup happened in the first place, or how that imbalance happened in the first place, so that we can prevent a recurrence. Okay, just as a heads up, around half of people who get treated for SIBO will have a recurrence. That's pretty standard right now, so don't be worried. Like, if you need a second round of treatment, you didn't do anything wrong, there wasn't anything extra that you could have done that you didn't do. It's pretty normal right now based on how our science is, that about 50% of people will get a recurrence. As long as you're addressing how the SIBO got there in the first place, you should not be chasing it around forever. Okay, so to treat the overgrowth, so your body can kind of go back to its blueprint, first you have to figure out what type of SIBO or EMO you have. There are two types of SIBO, hydrogen and hydrogen sulfide, and one type of EMO, which is methanogen overgrowth. Okay, so this is normally done by a breath test. So first you're going to eat a really bland diet the day before, it's super gross. Then you are going to drink a solution of either glucose or lactulose, which are just sugar. And then you're going to breathe into a tube a couple of times. You can do this test at home now. And what's going to happen is you mail in your tubes of breath, and the lab is going to measure how much hydrogen sulfide, and methanogen gas you exhale during the test, which is normally like 2 hours. And then we're going to see, based on how the gases rise and sort of how they fall and how frequently it happens, we can actually see where the overgrowth is in your gut, and we can tell which overgrowth you have by which gas you exhale. So make sure you do the test that checks for all three types of gas, because we want to make sure that we're sort of covering all of our bases. And it's really important to note that these breath tests are still quite new, so they're not super accurate yet. Sometimes you can get a false positive and sometimes you can get a false negative, but you still want to fight for the test with your practitioner, because SIBO and EMO are treated differently. So if you can figure out which one you have, you can significantly reduce the risk of relapse. Okay, so normally SIBO is treated with the antibiotic rifaximin. This is an antibiotic that isn't really absorbed into the body, so it kind of hangs out in the gut and works on the bacteria there. If you have a hydrogen overgrowth, in addition to rifaximin, you might be put on the low FODMAP diet to make you more comfortable during treatment, but this is for your comfort only. Okay, it's going to reduce the bug's access to fermentable carbohydrates, which is going to reduce the pain and blowing. bloating, but it doesn't heal or fix anything, okay? So if it's not giving you any relief, you can stop it. It's not adding anything to your treatment protocol, okay? If you have a hydrogen sulfide overgrowth, you may be given a low sulfur diet, not a low FODMAP diet. So same deal. This is just to help you be more comfortable. If it's not helping, you can skip it, okay? Methanogen overgrowth is a little bit different because methanogens aren't bacteria. They're something called archaea. So these type of buggies come with like a little spacesuit that will protect them from the rifaximin antibiotic. So normally we combine the rifaximin with another antibiotic called neomycin, and the neomycin is going to like break off their spacesuit so the rifaximin can like kill and maim them, okay? So because emo normally causes constipation, your doctor might also give you something called a prokinetic, which helps your muscles contract to kind of sweep the bugs out of your digestive tract while the antibiotics are working. That way it's less likely that there's going to be enough of those bugs left over that they're going to overgrow again. So if you don't want to add another medication, ginger is a natural prokinetic, and there are ginger-based prokinetics available. Ginger tea, all those things are not strong enough to actually work as a prokinetic. They have prokinetic like properties, but if you're going to go the ginger prokinetic route, you need to ask for a ginger-based prokinetic, and they can prescribe that to you, okay? So it's also important to note that you cannot starve out SIBO. You cannot starve out SIBO, at least not without doing serious damage to the rest of your microbiome, okay? So things like the elemental diet are not meant for typical run-of-the-mill SIBO, okay? If this is someone's first recommendation to you, you are in the wrong place, okay? If antibiotics are not clearing the overgrowth for you, you need to make sure that A, you have the correct root cause and you're addressing that before you would take a drastic measure like the elemental diet, okay? Also, SIBO doesn't thrive on sugar, so you don't need to like eat clean or eat organic to like starve out or prevent a relapse. Like obviously don't eat a diet of only Skittles, but if it's healthy enough for like the rest of your body, it's cool for your SIBO, okay? Finally, some practitioners do use herbal remedies for treating SIBO, especially if antibiotics aren't working as expected. Currently, we have one sort of viable research paper comparing herbal treatments to rifaximin. We call them antimicrobials, but it's important to note that the herbals were compared to a dose of the rifaximin antibiotic that's actually lower than what we would normally prescribe. So like while the paper is like totally legit, we still actually don't know how effective they are compared to rifaximin at its full dose. So you're welcome to try them if you have a reputable practitioner, but it's really important to remember that herbal medicines aren't neutral just because they're natural. So when I had SIBO, I had antibiotics fail twice, so we kind of went the antimicrobial route, and I got a liver injury. So like don't put things in your body willy-nilly, even when you're doing it really carefully with somebody who is trained to sort of go the antimicrobial route. We don't have a lot of information about the efficacy or the risks, so just keep that in mind kind of when you're weighing your options, okay? Before we kind of scoot out of this part, there's also a bug that can kind of overgrow in your stomach called H. pylori. So this can irritate your stomach lining, cause a little bit of fermentation, causing distension in your physical stomach. This is tested using a blood test and is treated with antibiotics like any other infection, okay? So if you're doing the SIBO test, nothing's happening, you're getting crazy bloated, something that's easy to test for is H. pylori, okay? So let's talk about too much nervous system. I love this one. Nervous system things are my specialty. So if you're having like anxiety issues in your body, if you're having symptoms that kind of come out of nowhere and you're like, I had nothing to do with that, what are you doing in here? This is my jam. First, we're going to talk about visceral hypersensitivity, which is when your nervous system is basically set to kill and you experience extreme pain and discomfort with sensations that should be really invisible to you, okay? So it's like one tiny gas bubble in your intestines creates like horrible pain, cramping, and bloating. So I have visceral hypersensitivity, and I would describe it as like being eaten alive by a T-Rex with barbed wire for braces while on fire. Okay, so it's important to remember that your pain is real. Okay, even if it is disproportionate to what's happening in your body, we feel pain in our brains. So if the message you're getting from your body is that you're dying, that is what you will feel. Okay, that is how it will be interpreted by your brain. So pain medication actually works by preventing pain messages from getting from the part that is hurting to the brain itself. It doesn't fix the pain, it only blocks the message. So in order to treat visceral hypersensitivity, we don't necessarily have to change what is happening in your gut. We do have to change the message that is coming up from your body into your brain. Okay, so little rundown, your organs run on a system called the autonomic nervous system, and this is supposed to be silent, right? Because we have zero influence over it. So it's kind of on a need to know basis. And this system should really only be interacting with you if it actually needs something for you. Like, can you take me to the bathroom? Or like, can you put your phone down and take me to bed? Like, why are you like this? Sometimes our brains will get confused and they will start to label things like normal everyday gas bubbles or like normal pressure or tension in our gut lining as dangerous. Okay, sometimes this happens after we have an accident, like out in public, or we have a close call where we almost have an accident and our brain is still worried that something is wrong or that that's going to happen again, or it has labeled it in a way that we think that we're not going to survive if it happened, right? If I had an accident in public, this would be unsurvivable. And now our brain has labeled this as like actual like fear of death. Okay, sometimes it happens after we get sick and we have temporary inflammation, like with a norovirus or gastroparesis, and the danger signal doesn't turn off correctly. So all of that irritation has healed, it's done, but your nervous system hasn't turned off the signal that there's something wrong in your body. Okay, sometimes it also happens because our body doesn't feel well, but it can't pinpoint the problem, and your brain is a terrible detective, and so it's just going to start tagging random sensations as dangerous. Okay, so all of these things can trigger your fight or flight response, which, say it with me now, can slow down or speed up digestion and lead to bloating, distension, and pain. Okay, so this system is supposed to work like a smoke alarm. It has a very specific job. If this house is on fire, let me know. So if it starts going off when you're like making bacon or you like drop a piece of cheese off your pizza, it is not operating correctly and it needs to be adjusted. So one way to like kind of scope out if this is something that's happening in your body is if it feels like your symptoms come out of nowhere, right? You're sitting in a car or you're at your desk or you're on the couch and like suddenly your gut just kind of erupts and you've got to run for your life, right? Or you just start ballooning up even though you ate the same things you eat all the time, right? This can indicate that your body has a stress cycle going on kind of in the background. And the easiest way to describe this is like with a panic attack, okay? So let's set the scene. Your brain notices that you kind of skip a heartbeat, right? Totally normal, happens all the time. But your brain is like, oh crap, something's going down, right? So it triggers your fight or flight system to kind of keep you safe, right? A normal part of fight or flight is that your heart rate increases. Like it has to do that because it's trying to get blood to your muscles so that you can run away or flight or fight. But your brain notices your heart increase and it's like, oh my God, I knew it. So it reinforces that stress response and now your breathing becomes shallow, which makes total sense because we're trying to get more oxygen to our muscles and to our brain. So we have sharper reflexes, like our muscles are all functioning because they have everything they need to like run or fight or do whatever. And your brain notices like, oh my God, it is going down. Like all systems loaded, right? And suddenly you feel your heart racing and you can't catch your breath and your mind is like just racing and you're just sitting here watching RuPaul's Drag Race and you were like, what the F just happened, right? Your gut issues can also start as a silent cue that triggers this stress cycle in your body. And the stress cycle can either cause you to kind of dump the contents of your gut because your brain is more concerned with running away than digesting your cookies. It's like, we will get more cookies at home, or it will like sort of put the brain is farting, or it will cause the gut to go to sleep so it can divert blood and energy into your muscles, okay? So this again can cause a buildup of fluid in the gut leading to bloating, distension, diarrhea, or it might cause food to sit in the colon where it continues to dry out and be fermented, leading to bloating and gas and stools that are harder to pass, okay? So this is one of the reasons that you always hear stress and anxiety prevention skills listed on IBS treatment protocols, right? Sometimes it is the smoke alarm that is stressed out, not you. So if you've done the diet things, you've done the supplement things, you've done like the fiber and the sleep and the exercise and the whatever, and it's not working, now we want to go in and say, cool, how is my smoke alarm doing, right? Are there things that are happening behind the scenes in my body that I'm not actually aware of that are triggering these sequences, okay? And that's not to say that you have a problem that you don't know about and only I can solve this problem. This is something that's pretty common in the IBS community, and there are lots of things that we can do, and you can get them lots of places, not just from me, that we can try and correct this labeling. So a couple of options are cognitive behavior therapy. dialectical behavior therapy, some forms of mindfulness therapy. There are mindfulness therapies directed like specifically at GI anxiety, so gut anxiety. There is gut-directed hypnosis. And our goal in all of these things is to reteach your brain what is actually safe and what is actually weird. So I'm trained in DBT and CBT, but you can ask me about any of these techniques if you've heard about apps like Nerva or Mahana, or any of those things. You can totally ask me about these in the Flip Your Leaf community. We can help figure out if they're right for you. Like I said, I have lots of tools for CBT and DBT. We do groups sometimes on these things, but I'm happy to help you out face to face, okay? So just so you know, in addition to kind of like lived experiences, right, or having an accident kind of triggering that miswiring, there are other nervous system settings that we know increase visceral hypersensitivity as well. And two of those are depression and anxiety. And this is not to say that the symptoms are in your head. That is not what we're doing. It is not to say that your gut symptoms are only symptoms of depression or anxiety. Ew, not what we're doing. All this means is that we know anxiety and depression can change the way our nervous system sees and categorizes danger because it's trying to keep us safe in a world that is feeling very dangerous, right? So you might have heard that we have a lot of the same neurotransmitters in our body as in our brains. And while the neurotransmitters in our gut, like serotonin, very famous right now, can't actually get into our brains because of the gut-brain barrier, there may be similarities with how our nervous system uses those neurotransmitters in our brains and in our bodies, okay? So this is why one of the treatments for visceral hypersensitivities is using an SNRI, like amitriptyline, which is normally used to treat depression, right? Because just like in our brain, in our body, it's turning down the volume of the danger signal kind of in our body and in our brain. And that's going to mean less pain from visceral hypersensitivity, kind of the same way that regular pain medication works by stopping the pain signal from getting from what it's hurting into our brain, okay? So, fun fact, some neurotransmitters in your gut also regulate how quickly your gut muscles move. So if your gut is going fast, and you're having like urgent diarrhea, you may be prescribed a tricyclic antidepressant, a TCA, which is going to tell your gut muscles to go slower. And if your gut is moving too slowly, you may be given an SSRI, which helps your muscles contract more efficiently. Oh, sorry, I'm going to cough. Hold on. That was not good. Oh, I'm back. Oh, sorry, if your gut is moving too slowly, you may be given an SSRI, which helps your muscles contract more efficiently, so you can have more consistent and productive bowel movements, okay? So, that was a good one. Hopefully that explains why some doctors are wanting to prescribe you brain medications, even if you're not experiencing like noticeable anxiety or depression. They don't think you're crazy. They don't think it's just anxiety. There is lots of there's not lots of research now on using brain medications for your gut, which funnily enough, researchers are now actually calling your second brain. So if you are worried about any of the side effects from taking these types of medications, when you're using these medications for GI issues only, they normally aren't given at the same dose as somebody who needs them to support their mental health, although this is absolutely a safe place if that's why you're taking them. But taking them at a smaller dose normally reduces the side effects, so they're much more tolerable once you've like done the couple weeks of onboarding them. Those can still be rough, like I'm not gonna lie to you, but once you get through those couple of weeks, they can work wonders on your guts, and you don't have nearly as many side effects as if you were taking a higher dose. You also don't have to stay on them forever. They can be really helpful kind of in managing your daily symptoms, kind of while you address that root cause of your symptoms. Like if you're using them to help clear out your SIBO while you're on antibiotics, helping keep food in your body long enough for you to absorb the nutrients while you do the low FODMAP diet, or you try treatments like CBT, or they can help lower your visceral pain load while you are retraining your nervous system to like calm the hell down. So they can be really useful to help you get what you want, even if you're using them in the short term, okay? All right, finally, let's talk about food, the thing we've all kind of been waiting for. Plot twist, before we talk about taking anything out, let's talk about putting some things in, okay? So first of all, are you constipated? We like to think about constipation as like, oh, I haven't pooped in a bunch of days, whatever. Constipation means you have pooped less than once every 3 days. So even if you're pooping like every third day, that could be totally normal for your body. Don't forget. But if you are pooping like if you're not pooping for 3 days, if you're pooping like every fourth or fifth day, constipation. But you can also be constipated if you're pooping every day, even multiple times a day, but your poops are hard to pass. They're painful or lumpy, they're like pellets, or when you poop, you don't feel like you're done, right? All of these can also be signs of constipation. And we want to make sure that we are managing that because, again, that can cause a physical buildup of stool, that can cause excess fermentation, that can trap gas. So all of these things look like bloating and distension, sometimes even pain, and they can really just be that one of your poops is stuck, okay? So first of all, are you skipping meals? You have to eat enough food to make a poop. Okay, if you are under eating, it may take longer for your body to make something resembling a poop, which means it's going to be drier and harder to pass. Also, a buildup of poop can create pressure in your gut and cause distension, bloating, distension. Eating on a regular schedule can also mean, not eating on a regular schedule can also mean that you are losing some of your natural gut contractions that happen through the day. Because when you eat, we trigger something called the gastrocolic reflex, which your body understands, okay, new stuff is coming in, everybody step one step to the right, right? And so everybody's kind of booped over one spot on the digestive tract. Now, if you're skipping meals, you are missing an opportunity to gently move your food along throughout the day, which again can help prevent a buildup of both gas and poop in your gut. Are you skipping meals throughout the day and then having a big meal when you get home? It is very difficult for your body to process large meals at once. So while your gut is kind of trying to digest your meal, you may have some distension and bloating in your physical stomach just from the volume of food. Your body could get stressed out and kind of tip you into fight or flight, which again is slowing down your gut and causing constipation and bloating as everything is kind of creeping through your system. Larger meals can mean more opportunities for FODMAP stacking, as your portion sizes in one sitting are going to be much larger than if you were to spread those sort of calories out throughout the day. Are you drinking enough water to poop? You need to drink at least 2 cups of water per day to make a poop. So if you are not drinking at least 2 cups of water consistently, start there before you add any supplements or make any dietary changes. The recommendation for water, sorry, asthma's a little funny today. Recommendation for daily water intake is 1 liter to 1.5 liters per day. If you're active, you live in a warm climate, you're in a larger size body, aim for half your body weight in ounces. Now, before you get waterlogged, Monash did a study on water intake for constipation and found that drinking more than the daily recommended amount of water, 1 to 1.5 liters or half your body weight in ounces, had no impact on constipation, okay? So focus on getting enough water, and then you've done that task and move on to something else, okay? If you are having trouble drinking water, aim for fluid, okay? You can't make yourself drink 2 glasses of water, but you can drink 2 large coffees consistently. That is better than not drinking enough fluid. For my clients, I'll accept coffee, tea, flavored water, water with fruit, vegetables, herbs in it, or soup if that works better for you, as long as it's like a broth-based soup and not a pureed soup, okay? Now, if you're getting enough food and water every day and you are not skipping meals, now we can talk about adding in fiber, okay? So if you are already eating a ton of fiber and it's not working, first ask me or someone on your healthcare team to help you add up your daily fiber sort of intake. We can do this in the community. That's a service that I'm happy to provide to you. But constipation and bloating can be caused by both too much and too little fiber, which we don't talk about for some reason. So if you are eating too much fiber, like over 30 grams per day, you may be getting a traffic jam in your gut where kind of all that roughage is building up behind your poop and it's causing extra fermentation and it's actually making it harder to poop. We have created a traffic jam, right? So sometimes we start taking out a little bit of fiber at one of your meals and kind of adjusting down each week until you're closer to your recommended range for your age and sex, because that's going to be sort of variable dependent, or your gut just starts to work more efficiently. If you are not getting enough fiber, you can increase your fiber by about 3 grams per week. That would look like adding a clementine to your lunch, or adding a handful of nuts or seeds to your yogurt in the morning. It's important to remember that fiber is broken down in our gut mostly using water. So make sure that you are adding an extra glass of water kind of until your body has gotten used to that increase in fiber, just to make sure that it has the tools that it needs to break that down, okay? And don't add in fiber if you're already constipated, okay? If you know that you are backed up, first we talk to your healthcare team about how to clearly safely clear any traffic jams. This is going to depend on how your unique gut works, so make sure you ask somebody who knows your body, okay? Don't start doing random stuff at home to try and clear the jam. That's like taking like random laxatives or fiber supplements you have in your cupboard, or like eating a giant salad suddenly with every meal. Depending on how jammed up you are, some of these things will just get stuck in the traffic jam as well. And now you have like water and fiber adding pressure to that system, okay? So ask your doctor for one thing that you should do, and let that specific treatment run its course before you try something else, okay? Then once the system is more open, we can experiment with adding more fiber, okay? So just as a heads up, it is absolutely normal for your gut to get a little more bloated when you add fiber, even if it's in small amounts, okay? So don't be alarmed if you like get a little poofy, and don't take the fiber out. Your body needs time to adjust, okay? You can make the fiber easier on your body to digest by like roasting or boiling your veggies, or like even some fruits. You can try reducing the particle size by popping them in a food processor so they're like tiny, or pureeing them into soups or sauces, or by using prepared products like nut or seed butter or hummus. By making the actual particle smaller, you are increasing the surface area for your stomach acid and enzymes to kind of help break down your food. Cooking your veggies really well also helps soften and actually break down those fiber strands, kind of outside of your body, so there's less work for your body to do, okay? So reducing the particle size of your fiber can also be helpful for some of the issues that we talked about earlier, like gastroparesis, like acid reflux, GERD, or dyspepsia, and for functional disorders like IBS, okay? And you don't need to eat soup forever either. This is just an easy way for your body to kind of get used to processing those fibers if it's really struggling, or this is a really great way to reintroduce these types of fibers if you've been steering clear of like fruits and vegetables or grains, for whatever reason, and you're trying to build up your tolerance to those again, okay? So this can also be a really helpful way to give your body some dietary diversity when you're having a flare up. So your body has something to work with while it's making repairs, right? If you are eating a good amount of fiber for your body, you're like drinking a reasonable amount of water, and you're eating regularly spaced meals, now we can talk about maybe looking at the type of fiber that you're eating, okay? So for IBS, GI issues, there are kind of two main types of fiber that we want to consider. So the first is soluble fiber, which absorbs water in the gut and makes a gel that helps kind of hold loose stools together. This is something that we want to see more of for people with diarrhea. The second type is insoluble fiber, and that isn't broken down completely in the gut, and so it's going to add kind of bulk to your stool, so your gut has something to grab, and it's going to be a little bit irritating to the gut, which can speed up gut transit time. So this is something that we like to think about for people with constipation. Most foods actually contain both types of fiber, which is great because we never want to lean like all the way one way or all the way to the other way. But if you're having a lot of water pulled into your gut, we might want to swap one of your lunch or dinner veggies for a soluble veggie, right? Or if you're having dry, hard stools, or you're not getting complete bowel movements where you kind of feel like you're not done, we might want to swap one of your fruits for like an insoluble fruit, like kiwi, right? To help kind of have you have more productive bowel movements. So there's a whole masterclass in the Flip Your Leaf Community Library on how to manage or use fiber to sort of help you manage your IBS. But again, remember what we talked about with pelvic floor dysfunction? If you are making changes, dietary or otherwise, and your poop changes, but the problem doesn't change, or it works for a minute and then it goes back to where it was before, or it gets worse, consider talking to a pelvic floor specialist, because the problem may not be your poop, it may be your butt. Okay. And again, we can't solve muscle problems with food or supplement, only physical therapy. Okay. Another food group we may want to look at before we do anything crazy is gas producing foods. So again, it is okay to get bloated after eating something that causes gas. That is every person's experience. As long as you are not like changing your pants or having pain, these foods are still really good for your body. Okay. So when we talk about gas-producing foods, we can think about cruciferous veggies like broccoli, cauliflower, kale, Brussels sprouts, collard greens, cabbage. We can also consider commonly fermentable foods like beans and leafy greens. Like there's a whole song about beans. Like we know that that is universal. So while all these foods are kind of known to cause gas in some servings, they're still packed with vitamins and minerals that your body needs to thrive. Okay. You can absolutely experiment with serving sizes if you're having like a really exaggerated reaction to that, but we don't just cut them out. Okay. Eating these types of foods regularly is exceptionally good for your gut bacteria. And we know that diversity can help reduce visceral hypersensitivity. It can help improve your overall gut kind of health over time, including increasing foods that feel good in your body. So things that aren't feeling great right now, but giving your body that kind of diversity, they might feel better over time. We expect that to happen if you have FODMAP sensitivities as you continue to eat like a wide variety of foods. We expect those FODMAP buckets to sort of renovate and get bigger over time, okay? So it's in your best interest to keep as many foods in as possible, even if you need to like kind of hide handfuls of them in a pureed soup or like a smoothie to make them more accessible to you, okay? So next, let's talk about the NICE guidelines. So these are evidence-based recommendations from the National Institute for Health and Care Excellence. And these are normally done after we check for things like hydration, sleep, meal timing, and daily fiber, okay? So we do all of those things, and then we come back to the NICE recommendations. So again, get your pen and pencil out. The NICE recommendations are to have fruits and vegetables at each meal, but we want to limit to 2 servings of fruit per day, so lower than the normal 3 servings. We want to add intermediate soluble fiber, which I like to call magic fiber because it helps with both constipation and diarrhea. You're going to find that in oats, chia seeds, flax seeds, linseeds, in supplements like sun fiber and fiber 4, which are made from partially hydrolyzed guar gum, which is a low FODMAP plant that's dehydrated and turned into a little powder for you. We want to reduce extremely high fiber foods, so things that might be difficult for your body to break down. So that's beans, excessive leafy greens, onions, garlic, wheat bran. Again, some of those we can make more accessible by reducing the particle size or by like boiling or roasting to death. We want to reduce resistant starches. So we talked about this before. Leftover rice, pasta, or cooled potatoes, as well as green bananas. So if your banana is really, really ripe and it's not sitting well in your stomach, wait for it to kind of ripen a little bit. And like I said, rice, pasta, and potatoes are absolutely okay in the meal that they were prepared for. But once they go into the fridge, they're going to break down and create some resistant starches, and that might be harder for you to digest, okay? So they also have recommendations outside of diet, which are to create relaxation time in your day, again, to kind of help your nervous system check in, make sure that your smoke alarm is calibrated nicely, to create a consistent sleep routine, because sleep is very important in the management of IBS and other gut dysfunctions. Again, I have a whole masterclass about that in the Flip Your Leaf community. We want to add gentle movement to your day, because actually moving your body is helping you to move things throughout your gut. That natural rocking and ebb and flow kind of throughout the day is also massaging your organs and helping them to perform their functions correctly. Just as a heads up, this is a lot of things. Do not do these things all at once. You do them one at a time so that you can control your variables. That way, if you try something and everything shifts, you're like, great, this is something that works for me. If you try something and it's a game changer for you, now you know this is something that you have to prioritize in your daily life. But if something isn't helping after a week or two, put it back the way it was and try something new, okay? That way we're not accumulating restrictions, we're not accumulating tasks that aren't helpful to you, okay? So if you try something, you make sure that you're consistent, you're tracking it, you're like really giving it your all. 2-3 weeks pass and there's no change. This was not effective for you, at least right now. Just put it back the way it was. Put it back the way that is natural to you, right? Unless it's drinking water, you still have to have 2 cups of water a day. That is just basic human decency, okay? But if you're trying something and it's not working for you after you've done it correctly for a couple of weeks, let it go. It's not helping you, so you don't need to do it anymore, okay? Remember, like, we also do have to give something the 2-3 weeks that it takes to get ready, or to sort of like get onboarded into your body. Like, you're not going to build a sleep routine in 3 days. You need to be consistent for at least a week, maybe 2, to kind of teach your body what to expect, and then your body will give you the results, right? If you're mucking around with fiber, you are not going to change your life after 1 serving of fiber, okay? You also want to make sure that whatever you're adding, you're doing it in a way that you can build habit, right? People who are successful at making changes in their lives are not using willpower, because willpower is a finite resource, right? When something else comes along and it's more important and that needs your willpower, you will drop anything that was in that container previously, right? So what we do is, like, if you need to get on sleep on time, you need anchors, right? If you're trying to drink your water, maybe store your water bottle on top of your coffee machine if you go there every day, right? So now you remember to fill it because it's sitting right there, and then just take it with you throughout the day, right? You need accountability, like an alarm, a post-it note, or a person who can come and remind you what you wanted to do, kind of check in. Are you doing the things? I do that with my clients all the time. Little notes in our platforming, like, hey, did you do the thing or not? And if they haven't, here's their cue to start it again, right? Again, if in the end the habit doesn't help, cool, right? You had practice building the habit though. If it does work, amazeballs, now you're already 2 weeks into making that sort of like a new part of the way that you do things, right? And our goal is soon you're not going to have to remember to do it at all, right? You're just going to reach for a glass of water and one will magically be on your desk, okay? Like mine is always coffee, but every time I reach out, there's one there, right? Build the habit. If these are something that you want to try, I can absolutely help you figure out which of the things that we've talked about today are most likely to help you based on your unique symptoms and your goals, right? Because being healthy means something different to everybody. I also have lots of tools and strategies to specifically help you build habits really quickly. So whatever you end up needing to do isn't taking up space in your brain, right? I know that IBS management just takes up so much of our time and energy and checklists and things we have to remember and monitoring our bodies. Our goal is to just have it be on autopilot, right? It's like your brain already knows which sock you're going to put on first. You don't even think about it. How do we incorporate the things that you need to be successful in exactly the same way so that you don't have to think about it, you don't have to remember it, it just gets done? Okay, so again, this is absolutely something that we can talk about during the community office hours, okay? Finally, last but not least, obviously, let's talk about the low FODMAP diet. The low FODMAP diet can be really helpful in reducing bloating, especially bloating with visceral hypersensitivity, just because it's so sensitive. And the way that it does this is it's going to actually reduce the amount of water being pulled into the gut, and it's also going to reduce the amount of fermentation, because FODMAPs are short chain carbohydrates that are rapidly fermentable, so they're very accessible to our gut bugs. Okay, so by taking out the water and kind of taking out this excess fermentation, we're going to reduce the amount of stretch and tension in your actual gut muscles. So again, we're changing that message that's going to your brain, where everything feels kind of okay now. You're going to get fewer panicked kind of messages coming from your nervous system to your brain. One thing that I do want you to think about though is that even though the low FODMAP diet may feel good, right? We are reducing those messages, we are reducing pain, we are reducing bloating and distension, pressure, tension, all those things. It's not healing anything, right? It's not fixing anything. It's not fixing your IBS. It's not fixing your SIBO. It's not fixing whatever someone told you it was fixing. It is only making you more comfortable, okay? The low FODMAP diet is also a bit of a trade-off because it's very low in prebiotics, like which I said are food for your gut bugs. So long-term restriction can have a direct impact on your gut health long-term. Like it's not anything that you should panic about. We used to be very like sticklers, like you get 6 weeks on the low FODMAP diet and you're going to murder all of the gut bugs in your, like, science again has done its job, and we understand now that while it absolutely will impact the gut bugs that you have, we do have a little bit of flexibility there, but it can cause different issues down the road, some of which are harder to fix. And so we really do want you to come out of the low FODMAP diet as soon as possible, okay? If you're not working with somebody who knows what they're doing, another thing that you really want to be sort of conscious about is that the low FODMAP diet can very easily become too low or too high in fiber, right? Both of which can make constipation, diarrhea, and bloating worse. And if you have visceral hypersensitivity, you are not in for a good time, okay? So we want to make sure that you have the correct instructions. And I don't mean like lists on the internet or people like on Instagram willy-nilly. The low FODMAP diet really is designed to be customized to your body, and it is not difficult. I can help you do that in the Flip Your Leaf community. You come, we talk about your symptoms, we talk about your body, we talk about your goals, and I will like hand you a simplified diet that you can follow. You can come and check in with me during office hours. It does not have to be scary. It does not have to be a big deal. And you absolutely don't have to do it by yourself, okay? Also, again, food diversity is one of the key ingredients to improving your gut health over time. That means eating a wide variety of foods prepared in a wide variety of ways. I always like to tell my clients, think of eating a variety of colors, textures, and temperatures to kind of get a nice rounded rainbow in there. Plus, remember, there is often more benefit to adding strategic things in than to take more and more things out. So we always want you to try adding things in first if you can, okay? Another thing is many high FODMAP foods are actually helpful to people who are having constipation specifically. We really do want them to be pulling in a certain amount of water, like not enough that you're having pain or stretching or anything like that, but adding that extra water into your digestive tract can be a very natural way of helping your stool stay like nice and lush and soft and easy to pass, all of those things. So if you need instructions on how to complete the low FODMAP diet properly, again, I can help you do that just for you, face-to-face and office hours. But I also have a full masterclass in the Flip Your Leaf community library that is going to give you like step-by-step instructions, things to look out for, like common misconceptions, to tell you how to do the program properly, okay? And again, I'm always available during office hours to help you customize that program so that you are only eliminating what you absolutely have to. Okay, so that's it for today, I think. We talked about a ton of things. We talked about too much food. We talked about too much gas. We talked about too much poop. If you have any questions about what we talked about today, you are more than welcome to email me at hello@flipyourleaf.com. If you think having me on your team might be helpful to you, either to kind of help you filter what information applies to your body, or you kind of want to skip Google and have me just sort of tell you the information that you need, or if you are working with somebody who isn't 100% trained in like FODMAPs or IBS and you just want some extra support, you are more than welcome to come and join us in the Flip Your Leaf community. You can find us at flipyourleaf.com/community. And I built this entire community so that you would have a place to come and talk to someone who is trained in all these things face to face. In the community, I can help you understand the mechanics of your body, kind of like what we're doing here. I can help you complete the low FODMAP diet kind of without all that stress and anxiety. I can help you understand and regulate your nervous system, kind of change how your body and your brain are talking to one another. And I can help you create a symptom management plan that looks at you as a whole person, right? Your brain, your environment, your emotions, your gut, your FODMAPs, all that stuff. The goal is that you stop thinking about IBS all the time, right? You let go of that constantly monitoring your body, trying to prepare for every possible emergency. Like, I have an IBS body. I am right here with you guys. I understand what it's like to worry about everything, every single thing you put in your mouth. What is going to happen? Am I going to pay for this later? This worked one day. Is it going to work another day? Like, it feels like Russian roulette every time you have to eat, which is unfortunate because you have to eat multiple times a day, right? Our goal in the Flip Your Leaf community is to help you just feel like a normal person again, where you get to think about normal person things and you get to invest your energy in normal person places and you get to have normal person experiences without this thing lurking in the back of your head, right? I mean, it's a chronic illness. We can't cure it as of today, but there are so many ways that we can help you manage it where it kind of becomes a thing of the past. And when you flare, if that happens, you know exactly what to do. So it's not a big deal. It doesn't eat a huge chunk of your time. You're not missing work. But that's kind of our goal in the community. And there are a couple of ways that we do that. First of all, we have a massive library of videos, downloads, cheat sheets, all that stuff. So you can explore a huge range of evidence-based tools that might be helpful to you, and like not just food restrictions. We kind of talk about everything. The library is designed by community members. So if there's something you need and you don't see it, you let me know and I will research it. I will reach out to my network and I will create that resource for you. We also have our weekly office hours on Zoom. This is a drop-in call where you can come and talk to me in real time. You get to ask any questions you have about your body, IBS, the low FODMAP diet, something you read, an app that you found out about, a supplement that you want me to look at for you. We also, as community member, you get to pick the topics of these master classes. So if there's something that you want to know more about, you let me know and I'll either come and make it for you or I will hire us an expert to come and speak to the group. Some of the master classes that are saved in our community library include, again, the ins and outs of fiber for IBS, using probiotics for IBS, understanding acid reflux and IBS, and now obviously managing IBS and bloating. I also have one coming up next month that is going to be on using enzymes and supplements to manage your IBS bloating. The community is a month-to-month subscription, so however you join us, you are absolutely welcome to come and see if it's right for you. If it's not, no hard feelings. If you like figuring things out by yourself, you can absolutely grab just the library and the masterclasses for $19 a month, and you can still email me with any questions that you have. If you want the option to come and talk to me in person, kind of get customized tools and advice for your body because we can sit and talk about what's going on for you, you can grab the office hours package for $29 a month. Again, monthly membership, so you can come and grab what you need and leave whenever you're ready. That's what it's for, okay? And again, you can find us at flipyourleaf.com/community. I had so much fun talking with you today. Clearly like to nerd out on things. So if you're looking for a nerd to help you out, I can't wait to meet you. But thank you so much for coming to our webinar today. I really appreciate you taking the time. I hope you learned some things. Ask me any questions that you have. I'm happy to answer them. And I hope to meet you soon.